This is Boomer Life on CL 650.
Welcome back to the program. A real pleasure to have Dr. David Liu from FalseCreek Healthcare Center and Eva Vein Care on the program today as we're talking about, well, veins and varicose veins and all these issues related to veins. And we Canadians, we're pretty good consumers of the internet, Dr. Liu. When we have something wrong, we generally will go to mayoclinic.com or jump on some medinfo.com website. We're pretty good at finding out what we think the problem is. We're kind of tuning up to the fact that we can become more informed, better patients, because we at least are trying to do the right homework. That's a kind of empowerment. And you, as a physician and a teacher, believe very strongly in empowered patients. Tell us about your take on empowering your patients.
I think empowering patients gives them the opportunity to make choices that are right for them. I see the relationship that we have at Eva Vein Care and our team as a partnership, as a collaboration with that individual coming through the door. Oftentimes, as you mentioned, the consumer, the patient, the client will have done a little bit of preliminary homework.
Sure.
And I certainly hope that that they come to our website because it's primarily designed to offer that type of information in that background.
Good, okay.
We hope that the person comes in with an expectation of being able to find the solution that may not be as cut and dry on the internet. As we oftentimes know, the promotion of certain procedures or certain treatments may potentially be based on a limitation of training, a limitation of access, or potentially a commercial interest.
True.
So we try to keep as neutral as possible by providing all of those options to our patients coming in the door.
Okay. What happens? And I'm sure it happens fairly regularly because, well, we're not doctors. So we go to the internet, we do the thing, we do the homework, we look it up, and so we show up at your office, and okay, thank you for seeing me, Dr. Liu. It's a pleasure to meet you, sir. I have blank, blank, blank. I've done my homework, and I have this condition. Mm-hmm. And I am dead wrong. I just am so wrong. Even you can't believe it. And yet, I've done pretty good homework, and so I'm convinced that I have this. That's happened to you before, hasn't it?
It's happened on occasion, yes.
So what do you do?
Well, what we try and do is take our clients, our patients, through the diagnostic and analytic journey. Our first consultation takes an hour, and in this day and age, that's pretty much unheard of in most medical and healthcare practices.
Absolutely true, yes.
Because what we try and do is analyze before we diagnose and before we prescribe. So when we take a look at the venous mapping, the direction of flow, the clinical history, we really strive to be able to bring that patient, that client, that person to an understanding of the rationale behind what we're proposing and how we propose it.
So the explanation might be, well, you know, I get why you think you have this condition, because when you went to such and such a website that you probably looked at this, and the patient will go, yeah. And then and so all you do then, I would think, is what you needed to do after that was investigate this, and that's the part they missed, and then so that was why they were wrong.
Absolutely.
And you can do that in a charming, fun way. You don't have to rag on somebody for trying to do good homework, now do you?
Well, oftentimes I give patients a 10-minute crash course in ultrasound diagnostics so that they know what the colors mean when we're doing the scans.
Right, and do they have the opportunity to see the images as you do the diagnosis?
They do. We really want to have our patients as partners in their care.
Right.
We really want to empower them to make the decisions objectively based on the choices that are available. It's not all about buying a Model T Ford and picking any color that you want as long as it's black.
Exactly, right.
We really do have a number of options, and we want to help navigate those waters with our patients.
And one of the things that FalseCreek Healthcare Center is quite famous for is the quality of people, and again we keep coming back to this, the amazing array of technology available under one roof, and all of those people who know what to do with it. So I mean, and they talk, and many of your colleagues have appeared on Boomer Life with me in the past, Dr. Liu, and they speak to a person of motivated patients. These are people who come to FalseCreek Healthcare Center. People want to get looked after. If I'm going to go to FalseCreek Healthcare Center, I have pretty high expectations. People show up at your office or at Eva Vein Care, same thing. They want to get fixed, and they're expecting you to be able to jump in there and get it done, right?
Absolutely. Absolutely. We balance out our time with our treatments with the fact that we want our patients to make the choice themselves. Obviously, there are certain conditions, certain medical conditions, where only certain procedures will work effectively
Of
as
course.
opposed to ones that they may know by name. But really, there are choices available, and there are options that are available. And I think that our partnership, Eva Vein Care's partnership with FalseCreek, has really allowed these patients to go through that journey, not only objectively with what we feel is the best care and best technology that's available,
Mm-hmm.
but also providing them with as many options as they can to be able to take control of their health and their lifestyles.
Can this whole varicose vein business, we've alluded somewhat in this conversation to the cosmetic versus the painful reality of it, and with the cosmetic likely to be of greater concern to more people.
Mhm.
But can varicose veins be a debilitating physical ailment?
Absolutely. It's not just about cosmesis. It's not just about how they look. Because it's such a slow process and slow, agonizing process to develop symptoms, oftentimes our patients that have received treatment for aesthetic or cosmetic concerns have noticed that their legs have decreased in swelling, that their dry skin, itchiness, and eczema has gone away, that the soreness at the end of the day is now much better, that they can walk a little bit longer. So there certainly is that transition of spectrum from cosmetic to medical conditions, and oftentimes those symptoms develop so slowly that people don't realize that it's actually happening.
You mentioned walking a number of times in this conversation, particularly with respect to the deep veins that are the whole walking process makes those veins work. It accelerates or maintains the process. So I would gather from a therapeutic point of view, walking in general is a good method of a good therapy, if you will. Is it useful in avoiding varicose veins? If you're a frequent walker and you're a busy exercise, you walk a half an hour a day. And is that a good preventative strategy?
Unfortunately, the way that the anatomy is organized, it actually won't have an effect on whether you develop varicose veins or not.
Okay.
The analogy that I try and draw is that the central venous system is like a vein inside of a can of soda, and the superficial system are like veins on the outside of the can of soda. So the veins on the inside of the can of soda are actually controlled, regulated, and they don't get big because the soda can wall is keeping it in place.
Of course, yeah.
But the veins on the outside don't have that ability to regulate. So the only way that we can regulate that outside pressure or accumulation of blood is actually through compression stockings, which I'm sure many of your listeners have experienced in a hot summer. And those are the ones that really.
Now you see, I hadn't thought of that. But when I talked about my grandmother having varicose veins, she had compression stockings, and I hadn't even thought about that for years. But of course, and she had them constantly. And those hot, sticky Ontario summers were just no fun for those particular piece of apparel. Now were they?
And particularly for my father-in-law, who is actually a perfect example of that.
Oh no, this is the fellow who wouldn't wear shorts in the summertime.
He would never wear shorts in the summertime. He would never wear his compression stockings, and as a result of that, he basically adapted his life. He's a very active person, loves traveling, loves walking, loves boating, and as a result of the disease process that was very slow and insidious, he really didn't notice there to be a problem until we were able to treat his varicose veins, and now he's in shorts more often than not, probably a little more than I'd prefer, but much more active and much more energy than before.
We're almost out of time, Dr. Liu. Can you, in a nutshell, describe what happens at Eva Vein Care and FalseCreek Healthcare Center with respect to varicose veins in the summer of 2015 versus the compression stocking therapy of the summer of, 1962?
Sure, things have changed a lot since then.
Just a little, huh?
So when a patient comes to be seen and assessed at Eva Vein Care, we really take a top-down approach. We do the full gamut of history and physical examination, as well as the latest state-of-the-art diagnostic tools, such as ultrasound, polarized lights, and lasers. When we put the roadmap together, we customize a plan with that patient based on all the tools and the comprehensive treatments that we have available to make sure that we can navigate through this journey together with our patients as partners, working towards better health and better appearances of their legs.
Well, and also I think a better informed patient is a better patient and more cooperative one overall too, right?
Absolutely. It's all about developing a partnership and empowering our patients to make the right decisions that are right for them, not just fit in a cookie-cutter mold.
Dr. David Liu from FalseCreek Healthcare Center and Eva Vein Care, both websites, why not? FalseCreekHealthcare.com and Eva Vein Care. That's EVAVEIN care.com, all one word. Dr. Liu, a pleasure to meet you. Thanks so much for popping in today. A very informative hour. I very much appreciate it.
Thank you very much. I appreciate the opportunity.
Well, good to have you aboard. And we'll see you next time, right here on Boomer Life.